Hello, everyone. Welcome to Health IT Matters, a podcast in which we explore the ways health information technology is transforming healthcare locally in Florida and on a national level. Health IT Matters is recorded live on the third Thursday of each month and explores the many facets of the ever-growing health IT spectrum. I'm your host, Corinne Slaughterback, and here with me are my colleagues, Pam King and Kim Davis-Allen. In today's episode, we will be speaking with industry leaders about e-prescribing. The agency has been promoting the use of e-prescribing since 2007, and we continue to outreach and share a quarterly dashboard of metrics that shows e-prescribing adoption and use trending, as well as comparison of Florida to national e-prescribing rates. Today, most of us understand or simply accept e-prescribing as part of the healthcare delivery system. We go to the doctor if medication is needed. The doctor sends information electronically to the pharmacy of our choice, and we drive to the pharmacy where the medication is ready waiting for us. Some may have noticed recently that e-prescribing is now allowed for controlled substances, or EPCS, where in the past many practitioners would handwrite these scripts. More and more providers are utilizing e-prescribing for controlled substance medications. This change was largely predicated upon new regulations and special e-prescribing software certifications. We're excited to have three experts in the subject of e-prescribing joining us today. We have Judy Monesteem, Jessica Sapp, and Ken Whitmore. Judy Monesteem is a faculty member at FAU, or Florida Atlantic University, in the Health Administration program. Her research interests include meaningful use of electronic health records, population health management, social determinants of health, and program evaluation. Dr. Monesteem's goal is to provide policymakers with recommendations to enhance the utilization of EHRs in low-resource clinical settings and, in turn, increase the usage of socioeconomic and demographic variables in these settings. Jessica Sapp serves as the Executive Director for the Florida Board of Pharmacy and the Florida Board of Dentistry and has worked in healthcare regulation for 17 years. She has served as the Program Administrator for the Board of Dentistry, Board of Physical Therapy, and Board of Respiratory Care. In 2015, Jessica obtained her certification as a Certified Public Manager through Florida State University. Lastly, Ken Whitmore is Vice President of Professional and Regulatory Affairs for SureScripts, the nation's largest health information network. Ken's responsibilities at SureScripts include monitoring and influencing state and federal laws and regulations related to health information technology, serving as SureScripts liaison to national and state pharmacy associations and boards, and providing guidance to the development and implementation of SureScripts programs. Prior to joining SureScripts in 2001, Ken was Vice President of Management, Professional, and State Affairs for the National Community Pharmacists Association. And with those introductions, I will now turn it over to Pam and Kim.
Thanks, Corinne. It's so great to be here today and to have these awesome guests with us. So I'm going to just dive right in. Ken, I'm going to start with you. And, I want to talk a little bit just in general about e-prescribing. Can you share with us what the current state of e-prescribing adoption is in the United States and a little bit about what's happening in Florida for both pharmacies and practitioners?
It would be my pleasure, ma'am, and good afternoon to everyone who's listening. I'm going to refer to a couple of resources as I kind of set the stage here. One is our 2020 National Progress Report. For about, 15 years now, we have annually put out a report on the status of e-prescribing and other types of clinical messaging across our network. So that's one of the resources. In addition, we every month generate state-specific reports to determine where things are within each individual state, and I'm going to refer to those as well. So nationally, with regard to, I'm going to talk about e-prescriptions, pharmacies, and prescribers, and then kind of turn it back to you. Nationally, excuse me, in terms of gross numbers, 2020, 1.91 billion with a B electronic prescriptions crossed our network, which was a 7% increase of the previous year. There was definitely an impact due to the COVID-19 pandemic when a lot of the care that was provided transitioned over to telemedicine, and accordingly, those prescriptions that were generated were more likely to be transmitted electronically. In terms of prescription rates across the board, as of the end of 2020, 84% of all prescriptions were transmitted electronically. 89% of non-controlled prescriptions were transmitted electronically, and 58% of controlled substances were transmitted electronically. And we're going to get to that, I think, a little bit with regard to EPS. In terms of pharmacies, what I've been saying for a couple of years is that they're there and they have been for years. As of May, 97% of all pharmacies nationally were able to receive electronic prescriptions. 96% of pharmacies nationally were able to receive electronic prescriptions for controlled substances. So by and large, the pharmacy world is tuned into electronic prescribing, and I've been saying for a while that if there are any pharmacies that are not currently capable of receiving electronic prescriptions, that's by their choice. It's not because the technology isn't available. We have over 80 pharmacy practice management systems connected to our network. So again, if there's a pharmacy that is not connected, it is by choice. In terms of prescribers, there's been great progress over the past couple of years, but there's still room for improvement. Noteworthy at the national level, we, at the end of 2020, exceeded 1 million prescribers connected to our network. As of the end of December, it was 1,040,000, and it is now increased even more to 1,078,000. So we figured that's probably about 87% of the universe of prescribers that are now connected to our network. With regard to e-prescribing for controlled substances, in terms of the nationally, prescribers that are connected for that, it's 68%. So there's a considerable amount of improvement that can take place there. And then finally, just to give a sense of where the states are with regard to mandates, such as Florida has in effect now, there are 33 states that have enacted some form of e-prescribing or EPCS requirement to date. And there are 4 additional states with legislation that is current. Of those 33, 23 states, those requirements are actually in effect. And as of January next year, the remainder will also take effect. So around January next year, we'll be able to say that 2/3 of the state will have some kind of e-prescribing requirement in place. And I think that's what I wanted to share to set things up.
So as a follow-up, Ken, how different is the typical e-prescribing rate versus the e-prescribing of controlled substances?
So again, all right, so nationally, as I said, 84% of all prescriptions are electronic, but just 58% at the end of 2020 were controlled substances. So that's a difference of about 25%. And in terms of, so you can look at it in terms of the number of prescriptions, or you can look at it in terms of the enablement of the prescribers, and obviously one leads to the other. But I can give you a couple of examples. Again, nationally, the most recent number was that 68% of e-prescribers were capable of transmitting controlled substances electronically. And that varies. In Florida, our most recent percentage was 51% are capable of EPCS. I would contrast that against a state where they've had a mandate in effect much longer than you have, New York. Their mandate is 5 years old now. They're up to 83% of their prescribers are capable of sending controlled substances electronically. And there's a great amount of variability from state to state in that regard. And there are a lot of different reasons for that.
Ken, just what are some of the reasons why providers are not e-prescribing of controlled substances? I had to make sure I say that correctly.
So some of it has to do with when mandates took effect. They vary. I mean, it's been a process going back. Well, technically, the first state that adopted an e-prescribing mandate was Minnesota, and that was back in 2011. But their mandate really didn't have any teeth, and we didn't see much of an effect from it. Really, the first meaningful state was in actuality New York, and that's been 5 years. And the states as they have come on, have kind of been staggered since 2016 and now. So the impetus from this regulatory standpoint hasn't been there in a lot of states. One of the other things that had an influence on it was when there was the federal incentives for physicians to adopt electronic health record systems via high tech. There were a lot of criteria that electronic health records had to meet in order for their end users to be eligible for the incentives. E-prescribing was the criteria, but e-prescribing of controlled substances was specifically excluded. So a lot of those vendors, wherein they were taking steps to make sure that their end users could e-prescribe, they weren't tackling the additional work that was necessary to give them the capability to e-prescribe controlled substances. So that kind of injected a lag period into the entire process nationwide.
Well, and that is a great segue into what I wanted to ask Judy about, because she has definitely done some studies on e-prescribing and its relationship to the EHR incentive program. So talk about that and how, as Ken was saying, you've seen those programs drive e-prescribing rates.
Yeah, absolutely. Thanks again for having me. So just as Ken was saying, if a provider is not using ePrescribe, it's because they don't want to, because the technology is definitely there. In addition, the incentives, were definitely there, or are still there as we're in stage 3. And so one of the things that I found through my research, specifically looking at Florida Medicaid providers, is that we've seen how the HITECH Act, as we call meaningful use incentives, has definitely increased the use of ePrescribe. If you look at the data between 2018, if you look at from 2011, which is when HITECH became effective, you can definitely see a big jump. Specifically in 2014, if you look at, it's almost twofold, where you're seeing over 40% of providers are ePrescribing. And so what we know is that these incentives do work. And as Ken mentioned, controlled substance was excluded from that. And so what we hope to see is with Florida's mandate, either July or January, that we hope to see that increase. However, in states, as Ken has mentioned, those 33 states, including New York, who's have mandated controlled substance for a while now, we definitely see they're at 80%. And so the goal is to also see that increase, especially with our Medicaid. When I say providers, those providers who have a high percentage of Medicaid patient populations. And so the meaningful use has definitely done its job in influencing and providing these incentives. But as you can imagine, with these busy providers who are wearing so many different hats, and in cases of big change management, having to now use electronic health records, it's no wonder why we don't see those high rates as well with controlled substances, because of course it was excluded in the meaningful use. And so we hope to continue to see that increase.
Judy, just a follow-up, and this would be purely hypothetical, but do you think that, or do you have any information on patient desire or lack of desire to have their prescriptions electronically sent?
Mhm.
I mean, is that an impact? I mean, is that impacting that as well, or could it impact it?
That's a great question, Pam. And I definitely could see it having an impact on patients having a preference, especially as you think about the opioids issues that we have here in South Florida. Many of you guys will recall. I'm not good with time, guys. It seems like the years go by so fast. There was a documentary maybe 2, 3 years ago, um, maybe 60 Minutes. Sorry, guys. I'll text my husband, he'll tell me. And where they were focusing on South Florida. And they were showing how patients in South Florida, the Delray Beach area, how patients were actually hopping from pharmacy to pharmacy to fill their prescription. And so, yes, Pam, we can definitely see some pushback from patients, given the issues we have here, not just in South Florida, but worldwide. And we know that COVID has only exacerbated that issue. And so we can definitely suspect that we'll have some issues. But that's, all the reasons of why we need to work together so we can definitely get those patients the help that they need.
Okay. I was, just when you were talking about it, just made me think, I wonder how many patients are going, no, I want that prescription.
Yeah, I want that paper prescription. Absolutely.
Yeah,
I don't want that electronic.
And and you mentioned that we have seen that upswing in e-prescribing. A lot of it because of the EHR incentive program, and we are starting to see an upswing in e-prescribing of controlled substances, and that's based on the law that Ken and Judy alluded to. Now, Jessica, can you share with us a little bit more information about what healthcare practitioners need to know about that law that requires the e-prescribing?
Sure, absolutely. So in 2019, House Bill 831 was passed, and this changed our statute 456.42. This relates to prescribing of medicinal drugs by healthcare practitioners who have the ability to write prescriptions. So this includes your medical doctors, your osteopathic physicians, nurses, dentists, podiatric physicians, and also optometrists. So those prescribing healthcare practitioners now have to comply with this law. The law became effective January 1 of 2020, and it brought the requirement for these different healthcare practitioners was based upon their licensure renewal. So these different professions renew at different times of the year, and they have to comply with this law either by their renewal date or by July 1st of 2021, here in just a couple of weeks. So we are getting ready to have all of our prescribing healthcare practitioners be in compliance and have to comply with this law as we're coming up on that July 1st date.
So Jessica, is there an exemption in all of that for controlled substances?
So there are exemptions, or we call them exceptions, for those healthcare practitioners. And so first, it's important to know that these requirements apply to those healthcare practitioners who maintain a system of electronic health records. So for those practitioners who have electronic health records, there are certain exceptions to e-prescribing. And those exceptions include the prescriber and the dispenser being the same entity. If the prescription cannot be transmitted electronically under the most recently implemented version of the National Council for Prescription Drug Programs script standard, it doesn't have to be transmitted electronically. If the practitioner determines that it would be impractical for the patient to obtain their prescription in a timely manner, they could write the prescription. If the medicinal drug that's being prescribed is under a research protocol, If the prescription is a drug for which the Federal Food and Drug Administration, the FDA, requires a prescription to contain certain elements that may not be included in electronic prescribing. Another exception is if the prescription is issued to a patient or an individual receiving hospice care or who is a resident of a nursing home facility, or if the practitioner or the patient determines that it's in their best interest to compare drug prices, prescription drug prices among area pharmacies. The practitioner would need to note that in the patient's medical record, and they would be able to write a prescription for that patient so that they would have the ability to do the comparison of drug prices.
So for all of those exemptions, would that need to be noted in the patient record? Or is it specifically just that one?
Yeah, the law specifically mandates it for that last one.
Okay.
I think that would be up to the practitioner to determine, what that best practice is, how they, want to record that or document that.
So there's not an across the board exemption for controlled substances. So it's all of these other things that practitioners have to consider and think about. Is the exemption process the same as the waivers? Because I also understand there's some waivers.
There is also a waiver. So one of the exceptions includes a waiver that the practitioner can submit. So this would be a waiver due to an economic hardship, technical limitations, or the law states exceptional circumstances that the practitioner can demonstrate. So this would need to be reported to the Department of Health. This is a waiver for 1 year. It's a very simple process. A practitioner can log into their Department of Health licensure portal account and submit their waiver. They can do it online. If they don't want to do that online, they can fill out a paper form that the Department of Health provides, and they would just provide one of those reasons that I just named, the economic hardship or technical limitation or other exceptional circumstance, and they would submit that waiver request, and we would note that on their in our database on their licensure profile. And again, that waiver cannot exceed a one year in duration.
Was there a significant number of practitioners that applied for the waiver, Jessica?
So right now we have about 60,000 practitioners, prescribing practitioners that have submitted waiver requests. And again, that's across all of those prescribing professions, including our doctors and our nurses and our dentists. We have about 60,000 waivers that have been submitted.
And so that's still in effect, that 1 year waiver.
Right. So at any time, a practitioner can request that waiver, and from the time they request that waiver, it's good for 1 year.
Okay. So they have up basically until July 1st, or to submit it, because that's when the law it has to be implemented.
Well, a practitioner could submit that at any time if they have technical limitations. If they were once able to e-prescribe and for whatever reason they can't do that at this time, they could submit a request for waiver today or in 6 months from now.
Okay, and can you renew a waiver?
So the waiver is good for a 1 year period. And there's nothing that prohibits a practitioner from submitting a new waiver request.
Oh, okay. So if they don't have the technical capability because they don't have the e-prescribing for controlled substance technology enabled in their system, then they could apply for a waiver.
Sure.
Judy, have you seen anything in the data that indicates that this requirement has moved more practitioners to e-prescribe controlled substances, or what are you seeing on that front, the e-prescribing of controlled substances and data around that? In the data that you're looking at, have you seen an increase in the e-prescribing of controlled substances. We've talked about it a little bit, but what are you seeing? What does it look like the trends are? And do you think that this law has impacted those numbers?
Yeah, definitely. As I had mentioned earlier, I definitely see, um, not specifically this law, but in those states where they have mandated e-prescribing for controlled substances, you definitely see those numbers are pretty high. Specifically, when you look at New York, for 2020 and 2019, they're up, over 80%, specifically for e-prescribe. Other states, as well as you see with Maine and North Carolina. I think it's interesting, as Jessica just told us, that providers will have that capability of having a waiver request. And so when you think about, Medicaid providers, it will be interesting to see, if they go for this waiver for maybe economical, like technical, as she mentioned. But we have seen, even here in Florida, although it's not mandated, we have seen those numbers as well increase. And so, the data will, hopefully continue to trend. Florida is up to now 51% of e-prescribing for controlled substances. And so we definitely, hope to see that those numbers continue to increase.
So, as I hear people talking about this and different things that you've mentioned, Ken, I will kind of come back to you with your experience. So for those that are working to implement e-prescribing, really, how does it work? We talk about the pharmacist side of it, we talk about the physician side of it, we talk about special technologies, I'm sure. So maybe we just need to kind of even level set to talk about, how does e-prescribing work? I'm one of those, like Corinne mentioned, I go to the doctor and I just go to the pharmacy. I don't know how it gets there.
As I said, the pharmacies are there, so I think we can probably pretty much exclude them from this part of the conversation. On the physician side, they have to be using an electronic health record system that is capable of e-prescribing and ePCS. Virtually every last electronic health record system that I'm aware of is capable of electronic prescribing, and the vast majority are capable of allowing providers to e-prescribe controlled substances. There's a setup process, if you will, that is outlined in the Drug Enforcement Administration's ePCS rule that all of these vendors have to follow. But at a high level, what it involves is a physician having to go through an identity proofing process. And once they've completed that process, their electronic health record system company will issue them a two-factor authentication credential that they are then going to use to be able to issue ePCSs. Two-factor authentication is something something you are, something that you have. Most of us use two-factor authentication. The most popular example I can think of is the ATM machine. When you go to get money out of your ATM, you're using something that which is your passcode, and something you have, which is the card that you put into the device. There are a number of different two-factor authentication modalities that the DEA does allow, including biometrics. And once that's issued, the provider uses that to set their system up in terms of who can access the EHR and use it for ePCS purposes. And then every time they issue an ePCS prescription, they use their two-factor authentication to digitally sign it. But it is a process that the providers basically have to depend upon their electronic health record vendors to do. In terms of Florida, this is one of the statistics that we break out. But as of the end of May, the statistics we have that 83% of prescribers in the state are using an electronic health record system that is capable of ePCS. So it shouldn't be that hard for providers to get set up for it in the state if they so desire.
So one question question. So talking about the two-factor authentication, is that just for controlled substances, or is that for like every prescription that you might digitally sign?
It's in terms of the regulations, it's only required for controlled substances. There may be some electronic health record systems that use two-factor authentication just to access the system, to be able to look at, all of the various clinical parameters that are addressed in an EHR. But from a regulatory standpoint, it's not required. And I think probably in terms of signing non-controlled prescriptions, the vast majority of EHRs wouldn't require two-factor authentication for that, because it is a little bit of additional administrative overhead. And I think there would probably be a lot of provider pushback if they had to do that for, every prescription.
And I know way back before such a prevalence of electronic health records, there were a lot of standalone e-prescribing systems, or I guess maybe that was the beginnings of not fully functional EHRs. Or do you still see that, or is it all pretty much the one system?
There are a handful of systems out there that I would still call standalone, but they've obviously waned tremendously over the years for the reasons that Judy mentioned in terms of the incentives and, for providers to adopt EHRs, not just to e-prescribe, but to do an awful lot of other things. So it's definitely a waning portion of the market, but I guess they have served somewhat of a service to providers who didn't, they wanted to be able to meet a state mandate, but they didn't want to invest in a full-fledged EHR. Maybe they're at the end of their career, and or maybe dentists. They're categories that they might still want to take advantage of that technology.
Ken, just a follow-up to that, does the e-prescribing systems allow for basically communication between the pharmacy and the provider? So say a physician prescribed a medication to the patient's pharmacy, but the pharmacist didn't have that specific medication. How is that handled? Are we still going back to phones and communicating by phones through that, or can you do it through the e-prescribing system?
You can. It's technically possible. There are, we focused on electronic prescriptions here, but there are a lot of other types of communications that can take place electronically on our network. The most popular is a refill renewal request, which traditionally has been when refills run out on a prescription, the pharmacist would pick up the phone or send a fax to the provider. That can be done electronically. But in terms of the use case that you mentioned, there's also a transaction known as RxChange. And it is designed to allow a pharmacy to send a note back to a provider. There are 7 identified use cases for that particular transaction right now. Could be for a clarification, therapeutic interchange request, and like I said, there are another 5 that escape me at the moment, but there is that capability. There's also the capability in the system for providers to send a cancel message to pharmacies indicating that they no longer want a patient to get a specific prescription, and they ask the pharmacy to cancel it. These transactions have been supported on our network for about 8 years now, but the uptake both on the EHR side and the pharmacy side has been pretty slow until the last couple of years, and we're seeing a lot more uptake, particularly the cancel transaction, where we're seeing a lot of interest from the physician community in that, and then the RxChange. And so yeah, it's available to do those types of transactions as well.
And what about patients not picking up their prescription? Is there a way to send that information back to the physician? Or is that something you're going to put on your to-do list?
There's a transaction that is known as, no, we got one of those for that too, but it too has not been widely adopted. It's known as a fill status notification, or technically RxFill. And it is designed, it's designed for a pharmacy to be able to send a message back to a provider indicating that a prescription either has or hasn't been picked up by a patient. By and large, I would have to say that the industry hasn't really embraced that. You know, there's some workflow issues surrounding it, and incentives, and some things that just kind of haven't been worked out. I mean, it is available, but for example, you know, if you decide you're going to send a RX fill message back on prescriptions when they get filled, well, that would be a lot of messages going back to providers, and they would probably they wouldn't know what to do with them all. So you could then opt, well, we're just going to send a message back to the doc if a patient doesn't pick up a prescription. Well, then what parameter do you wait? A couple of days, a week, 2 weeks, a month? And what criteria do you judge? So it's kind of gravitating toward a scenario where a provider would indicate that on a specific prescription, they want to know whether or not the patient got it in a certain time. So that's where we're starting to land. But again, it's not widely adopted.
Okay. That's just something I hear when we're out and about, that physicians really want to know, hey, did my patient pick up this prescription? But I understand that saying it and implementing it are 5 different things.
Well, there is, and I don't want to be remiss here. The other way the physician can get that information is via medication history, and we have a product line where we provide medication history through EHRs to providers, and they can see by evaluating what they see in a medication history whether or not a patient has gotten medications as well. It's not a direct message. They have to go in and look, you know, search for it, if you will. But that's another way they can get that information.
So Jessica, what are some of the common questions that providers or pharmacies or patients are asking about e-prescribing?
So I will say, like I said earlier, the law changed a little over a year ago in January of 2020. So our questions have started to slow down. In the beginning, we received a lot of questions asking for clarification about maintaining electronic health records and whether or not this applied to a healthcare practitioner who still maintained paper patient records. As the law pretty clearly indicates, this is for those healthcare practitioners that maintain those electronic health records. We also got questions from practitioners who needed clarification on when they were required to comply with the law. As the law indicates, it's by their renewal or by July 1. Some of our professions, for example, dentists, they were in the middle of a renewal cycle when the law became effective January 1 of 2020. So we'll just say half of our dentists had already renewed their license prior to the law becoming effective, and the rest still had not renewed. So for those dentists who had already renewed their license prior to the law becoming effective, their date to comply with this would be July 1 of 2021. For nurses and medical doctors, they're on a phased renewal cycle. Not all doctors and not all nurses renew the same time every year, like a smaller profession like dentists do. So we provided lots of clarification to our practitioners on exactly when they would be required to comply with the new e-prescribing requirements. So that kind of had a little bit of a trickle effect for the pharmacies. And the pharmacies were asking whether or not they needed to verify whether or not a prescription they received could be a written prescription, a verbal prescription, or if it had to be an electronic prescription. And this law does not mandate a pharmacist to verify that. It is up to those healthcare practitioners to ensure that they're complying with this law. We also get questions from pharmacies regarding if they are mandated to accept electronic prescriptions. And while this law does not specifically mandate that, a pharmacy would of course need to ensure they have the appropriate software to accept electronic prescriptions, as practitioners would only be allowed to write or call in a script under one of the exceptions that I had mentioned earlier. So that would be very limiting to that pharmacy.
So are there penalties or what happens if a doctor has the capability and is able to, so they have the technical capability, and the patient, that, you know, there's not a reason for them not to e-prescribe, but they just don't want to. What would happen?
Well, that's a great question. So, you know, that could really depend on a number of circumstances. A practitioner is potentially in violation of a law or a rule, then that is investigated by our enforcement section of the Department of Health. And so that could play out in a number of different ways, but it could be subject to a penalty for not complying with the law.
Okay. So there are penalties that would or could apply to them depending on the situation, and making sure that they don't meet one of those exceptions and all of that.
That's right, correct.
And I would imagine it would depend too on, did they write the script and was there an error in the script that they wrote? And then that would have a large impact too, I would imagine, on any disciplinary action by those providers. Judy, I've known you've done lots of research on this and on electronic health records. What are some of the benefits of e-prescribing that you have learned about as you've done all of this research?
Yeah, great question, Pam. One of the benefits that providers have said is the efficiency. And so how ePrescribe really allows them to be more efficient in how they practice medicine. I believe it was about 70% providers had actually said that it reduced the administrative burden after prescribing. So that callback that you had asked Ken about, right? And I think aside from that is a lot of these pharmacies too, they also send the patients a secure message right on their phone to say, hey, your prescription has been sent, it'll be ready, at this time, or we're on back order. So there is a form of efficiency too, for busy moms out there, right? That you're not sitting at CVS like I have in the past and waiting with, crazy kids at the back. And so that's also a benefit of ePrescribe. Back to the provider side, another thing that providers have said is that it also improves patient satisfaction and as well as patient care. And so there's lots of benefits. In addition to that, what I've seen in the data is that ePrescribe has been one of those functions of meaningful use that has been really easy to use. And so the effort that's needed to use is not as, other meaningful use like secure messaging or maybe some other those other functions. And so I would say that all around, ePrescribe has been one of those functions that we've seen in the data that shows that providers are, really willing to use it because of the efficiency.
Pam, if I could just kind of tag onto what Judy was saying, I absolutely have to agree with the efficiency part of that. We're hearing that from our practitioners, from the pharmacies, and also from some patients. Like Judy mentioned, you would be able to leave your doctor's office. You don't have to have a prescription in your hand to take to the pharmacy, drop off, leave, wait while you're getting that filled, and come back. In many cases, you can leave your doctor's office. By the time you get to your pharmacy, it's there waiting and ready for you. So I think it's efficient for all parties involved. From a pharmacist perspective, from that pharmacy side, the pharmacist does have an obligation to ensure that the prescription they're filling is a legitimate prescription. And when they have a prescription, an electronic prescription, there's no question that that's a legitimate prescription. And I think it's also beneficial in a way. It probably reduces medication errors or errors in filling those prescriptions. Those electronic prescriptions are very easily legible. And there's no question about what exactly that practitioner is prescribing. So I think those are some of the benefits as well.
A big thank you to everyone for being part of today's conversation on e-prescribing. We hope you'll join us for the next edition of Health IT Matters, Thursday, July 15th, where we'll be speaking with agency staff on several Health IT initiatives. You can stay up to date on future Health IT Matters episodes and agency news through our social media pages on Twitter, Facebook, and LinkedIn. And if you've missed previous episodes of Health IT Matters, you can now access them through posts on our social media platforms. So thanks again, everyone. I'm Corinne Slaughterback, and this is Health IT Matters.